Those aren't my panties.
I know. Hypothetical. A young woman does something clumsy in public. And instead of laughing it off, she gets irrationally upset. Explain.
Maybe she's clumsy because she's nervous because she forgot to do her spelling homework. In my hypothetical, she's 8.
But this girl is not insecure. Seems more like she's afraid.
Do you have a point, or did you just get a new book of riddles?
I think you're hiding a medical condition.
I'm not. I'm glad we had this talk.
Doctors often try to ignore their symptoms because they think they can't get sick. If you've got something going on, I need you to take care of it.
And I take your compassion entirely at face value.
It's not compassion. Self-interest. I want my team healthy.
It's not self-interest, it's curiosity. I dropped a file, House. I start bleeding from the eyes, I'll be sure to make an appointment.
Okay. I have a new theory. You're not stubborn. You're not getting it checked because you already know the answer. Found an old picture in your wallet.
Of course you did.
I wasn't snooping. I needed lunch money. Figure it's your mom, except she looks about 32 years old. Well, the only reason not to update a photo in 20-odd years is she's not talking to you, which would be interesting. Or she's dead, which should also be interesting. She's dead.
So's Grover Cleveland.
Pretty young to have a dead mom. Even younger, 20 years ago. I Googled her obituary. Said she died at New Haven Presbyterian after a long illness. Parkinson's?
Huntington's chorea.
I'm sorry.
I'm leaving when this case is over.
No, you're not.
You don't want a doctor on your team who's slowly losing control of her body and mind.
Huntington's isn't the only thing that causes tremors.
You think it's just a coincidence?
I think you're the only one on the team who drinks decaf. I've been switching it out with regular ever since you dropped that vial. You're trembling because you're hopped up on caffeine. First vial was my fault. Medical explanation for that is people drop things.
I've been walking around thinking I'm dying.
You are.
You don't know that.
With Huntington's, it's inevitable.
No, you don't know because I don't know.
How could you not get tested? If your mom had it, it's a 50% chance you're a bomb waiting to explode.
Not knowing makes me do things I think I'm scared to do. Take flying lessons, climb Kilimanjaro, work for you.
Yeah, 'cause if you knew, you couldn't do any of those things.
What the hell is this?
Looks like an envelope with the results of the genetic test for Huntington's inside.
Did you look?
I thought it'd be fun to find out together.
I don't want to know.
No, you're afraid to know.
I might die. So could you. You could get hit by a bus tomorrow. The only difference is you don't have to know about it today, so why should I?
I don't have to know the lottery numbers, but if someone offered them to me, I'd take them.
You spend your whole life looking for answers. Because you think the next answer will change something, maybe make you a little less miserable. And you know that when you run out of questions, you don't just run out of answers. You run out of hope. You glad you know that?
I'm thinking of spending a few extra bucks on my Secret Santa.
Bad idea.
You mind if I tell House you asked him for the key instead of breaking in?
Yes, I do. Just another $5.
5 will be 10. The key's proof she doesn't have anything to hide.
The key is proof I didn't do exactly what House told me to do. And what do you care if it's another 15?
I'm gonna tell him. Who are you so anxious to please?
Not you. You really think you're gonna prove people are capable of honesty using a mother and daughter you've known for one day?
I'm not the one who's based his entire worldview on the proposition. If I'm wrong, so what? If he's wrong.
So you've got Huntington's?
Nope.
But House said that
If I wanted to talk about it, why didn't I bring it up?
Sorry. Wide stance.
You're right. I'm screwing up.
Why are you screwing up?
I didn't even like her.
Did you hate her?
Not enough to want her dead.
It's not guilt. That just leaves fear. A young woman dying. A young doctor dying, in fact. Does that sound familiar?
Yeah. I'm at risk for Huntington's. I've dealt with it.
By not getting tested. Dealing with it by not dealing with it. It's clearly working beautifully.
You are the champion of not dealing with your problems.
My grandson gave me a mug that says that. Okay, enough hand-holding. Deal with it, get back in there, or pack up your stuff.
You're screwing up this case worse than I am. Why is everyone leaping to conclude a strong career woman's been made sick by her strong career? It's not B12, it's an insulinoma in her pancreas. It's making her hypoglycemic.
Great. Now everyone knows.
You knew the patient had cancer?
Is that what she said? I thought she said, I am suddenly and irrationally defending the patient's strong career, even though in reality she's just a glorified grunt. Because I'm trying to convince myself that it's okay not to have a life, because I don't have a life, because I was tested for Huntington's, and my lifespan's been cut in half. Been waiting 2 months for her to say that.
Hallucinations, anemia, and bradycardia.
Hypersegmented poly, says the Taub's right. Upper full of B12. See how a strong career woman's been made sick by her strong career.
Are you okay?
Could be years before you see any symptoms.
Why wouldn't you tell us?
I don't have Huntington's.
Are you lying to us? Because it's none of our business?
If it's none of your business, then I shouldn't have to answer these questions. And I wouldn't have to, except House doesn't want to answer questions about Wilson. He's deflecting his own problems onto me.
Are you deflecting now?
Time for the B12 cocktail in my life lesson.
It's not the surgery.
Timing fits.
The location doesn't, unless her brains are in her bowels.
If bacteria entered her bloodstream, it could have caused an infection in her brain.
The surgery went fine. You were there, you saw.
Peptostreptococcus could explain the blinking and the...
No. You want to watch a grainy video and have an epiphany.
Shut up. You're making me miss House's mocking.
I know you told us it was none of our business, but if House thinks that your Huntington's is affecting you, maybe it really...
It's not, because I don't have...
You're desperate to do this without him. You're not trying to cure her. You're trying to prove...
Stop the tape. Zoom in. On the anastomosis, that little bump.
It's a hematoma, a harmless pocket of blood, which is why Chase ignored it during the surgery.
Could be a ganglioma, which is why Chase shouldn't have ignored it.
It's an abnormal growth of nerves. Could be causing all the patient's symptoms. We have to open her up again, get a piece of it.
Don't expect anything to change too fast.
Lymphoma was your idea?
Why?
I feel better.
Sometimes just knowing you're being treated helps.
You've given me 18 different treatments. This is the first one that made me feel better. I don't think it's psychological. Thank you.
I'm sorry. I shouldn't have gotten angry at you. Your choices are your choices.
You're not like me. Maybe you have wings.
I have Huntington's chorea. Dozen years or so, my nervous system, my cognitive skills, even my emotional balance, they'll all start to fray. I won't be able to fly. I won't be able to walk. I won't be able to breathe.
And you want to make sure your life matters.
I don't want to just be tightening bolts and following instructions. I want something to be different because of me.
I am. Not just because you saved my life. I'm applying for a job at a foundation, running the finance division. And I don't know if I'm gonna get it, but if I don't, there are other foundations.
Empty, transient sex? I've been waiting for you to spiral out of control ever since you got your Huntington's diagnosis. But this is more than I dared hope for.
Patient's seizure resulted from dehydration, which resulted from a cocktail of alcohol and ecstasy. Mystery solved.
Wait, were you doing drugs?
Not diagnostically relevant.
That's what we're trying to diagnose. It's how steep of a spiral you're on.
Our patient hemorrhaged into her eye 2 years ago.
Also not diagnostically relevant. Retinal vein occlusion was fixed. Her doctor said it was a venous anomaly.
Is he in this room? Because if he's not, I don't care what he thinks. Unless he's a she and she was there last night too, in which case I care very deeply.
Or if the eye problem wasn't with her vein, but with her blood, would explain why she sees, why she's always tired.
She parties till 3 a.m. That's why she's always tired.
Yet you seem fine.
She's visited 4 other doctors in the past year. None of them found anything. She's a hypochondriac who drank too much.
Blood clots could explain everything.
Makes sense. Bone marrow's in overdrive, too many platelets. Sorry.
13. Go stick a needle in your girlfriend's pelvis. And no, that one wasn't a metaphor. Suck out some marrow. That one was.
Got a minute?
Nope. Routine checkup can wait. What else you got?
I'm consulting on some clinical trials that involve CNS compounds.
While it's true that no sometimes means yes, in this context.
One's a new Huntington's drug. Phase 3 trials are showing real results delaying neuronal degeneration. Probably get you in.
No, thanks.
Are you doing anything about your disease, following any kind of program?
Nope. Nor am I looking for a consult.
This is a level of risk-taking beyond anonymous girl-on-girl action.
They're patients. I'm a doctor.
With a degenerative, drug-unfriendly illness.
Everything's not some fascinating character flaw.
This is a genetic flaw. This is your Huntington speaking. This is you waving a white flag at the world.
Yes, I have a shortened lifespan. Another reason why I'm objectively the right choice. Ah!
Wow. I would have laid money you had herpes. If you have Cushing's, this will slow your breathing.
Give it to her first.
Those were not the terms.
I lied. These drugs could be fake.
Why would I do that? I gave you back the gun.
You wouldn't. They would.
She has Huntington's. These drugs are real. It could screw up her liver.
Chances are slim. Chances of him shooting one of us, on the other hand.
Don't do that.
How long do you have to live?
8, 10 years.
Killing her is your chance to get personal?
Huntington's doesn't have a cure.
No.
So if we get out of here.
If she were clinging to hope, she wouldn't be standing in line waiting for you to order up more drugs. Take a deep breath.
Not knowing what was wrong with me made me miserable. Maybe that's insane. Doing this. Yeah, insane. But I had something to gain. You can't take risks, no upside at all.
I can't decide which is riskier, taking crazy risks or taking advice on crazy risks from a crazy risk taker. All heart's racing. Fever. And your breathing's unchanged.
Does that mean
Means I was wrong. Her kidneys are shutting down because of the meds you made her take.
A week of temporary dialysis, your kidneys will be okay. I'm sorry I backed out of the differential.
About that Huntington's drug trial.
It's gonna be okay.
Never showed up.
Get out of my house.
I wanted to find proof that you were slipping back into your self-destructive pattern. Confirm you weren't worth my time. Instead, I found this. You followed all of my instructions to the letter. Probably better than any patient I have. So why are you the only one who can't show up for appointments?
I came down right after I was finished with House. You were in your office with another patient. And there was another patient in the waiting room.
Janice.
I'm well aware of what's going to happen to my body over the next 8 to 10 years. I do not need a visual reminder every time I walk into that place.
It's understandable. It's human. And you need to get over it. You show up on time tomorrow, or you don't show up at all.
Your mom is leaving. You're gonna regret this the rest of your life.
I'll keep coming, but can you change my appointment time?
Can't. The schedule's full. You're stuck with her. Might as well get to know her.
I lied to you the other night. That woman in the waiting room, she didn't freak me out about my future. She freaked me out about my past.
Your mother. It must have been horrible watching her die.
I wanted her to die. She just yelled so much. For no reason, just screamed at me in front of my friends. My father tried to explain to me that her brain was literally shrinking, that she didn't mean it, that it was the disease, but I didn't care. I hated her. And never said goodbye. And she died with me hating her.
You all right?
Don't be paranoid. I feel great. Didn't expect the meds to work this quickly.
Let's not get ahead of ourselves. You might not even be on the real drug.
Several patients have shown improvement. I know my test results have been better. I know I have more energy.
You ever hear the term placebo effect?
I guess I do have a few reasons to feel good. But let's not get ahead of ourselves. You're good, but not curing Huntington's good.
You drool.
Shut up.
Good?
Yep.
You okay?
Just a headache. I took some ibuprofen, but...
Where's the pain, front or back?
Front? Why are there nobody interesting pictures on these cards? They should make a dirty version.
Sharp pain or more of a throbbing?
Relax. It's not a side effect. People get headaches.
True, but I can get you an MRI.
If I'm on the drug, it's been weeks. It's not like something's gonna suddenly crop up now.
Okay, first card.
Train, duck,
You can't remember?
piano.
Look straight ahead.
Why didn't we do this test this morning?
You see that?
No.
Damn.
I'm losing my peripheral vision? I am on the drug. Does this mean you have to tell them and take me off it?
No, and yes. As far as they're concerned, you're on placebo. I found out last week. The trial was getting positive results. So I switched you.
So my headaches. I'll stop taking the drug and everything should be fine. Specimen's negative for blastomycosis.
That's it?
I'll go give House the test results. You can tell the patient.
Hey.
We've been dating for 2 weeks. You just broke trial protocol and risked your entire career to give me a drug we're not even sure will help me. I don't think I'm ready for that.
You want to talk about your headaches?
Not particularly.
You went off the drug, but the headaches are worse. You need an MRI.
Patient needs an MRI. If she had gangrene, would you be amputating my leg?
These pills have codeine in them? You're taking twice the indicated amount.
I've only been off the drug for 24 hours, so I think the bigger issue here is that I've been off you for 24 hours.
You have worsening headaches, loss of peripheral vision, and a long history of pretending bad things aren't happening. You really think this is just about my hurt feelings? I'm sorry. I figured only one of us needed to go out on a limb. I thought I could help you.
It's hard to have a conversation when I'm trying not to move.
Oh, God. So I spoke with House. He thinks we should just...
My leg is bleeding.
What happened?
I was going for the phone, and I fell over the table. I can't see anything.
Have you thought about going to the drug company, see if they can help?
I thought about it.
We need to give it more time. It's been half a day.
This thing keeps growing. There's other stuff in your brain you might need later on.
If I were any other patient, you'd both be in the lounge eating donuts.
You're not any other patient.
Right. Any other patient, you don't feel guilty. But you don't get to torture your career to pay for your sins.
House told you to say that, didn't he?
Does that make it any less true?
You think he's right?
Who cares? You're a hypocrite. You don't ask her if she wants to be on the drug, but when there's a chance you could help her get better, suddenly you're letting her call the shots. That's not being noble, that's saving your own ass.
I'd feel worse if he destroyed his career.
I'm sorry.
Foreman? I can see you.
Last week, my cane could only do 10 minutes.
What are you doing here?
Waiting for you to take a nap so I can surge into the lead. What's the best way to restore the liver in someone with sclerosing cholangitis?
Not getting drawn into this.
You already are.
Because you crashed my workout?
You're doing core training, which improves balance, which staves off the most debilitating symptoms of Huntington's. You've ended your self-destructive streak. You want to do something significant. Something that'll last longer than the few years you have left. My team is your first best choice.
And my first choice is the community health clinic I interviewed with yesterday.
Absolutely, you should do that. 3 hours a week. Every doctor should, because every doctor can. But you don't want to be every doctor. Plus, on my team, you get to screw with Foreman. Every way, but literally.
Why are you doing it this way? You're pretending to assume we're all coming back without actually asking us. Why?
See, this is why you'd be miserable wiping noses in a clinic.
You can't ask because you can't face the rejection. Why not? What's going on?
Are you asking me to ask you?
I'm saying you shouldn't. For your sake as well as mine. Truth.
Shut up.
I'm sorry.
It's not your fault.
No, I didn't even play fair. You asked me how my dad reacted when I told him I was bisexual and the Huntingtons.
No tea party?
I never told him. He's been through enough.
So he just visits his heterosexual, healthy daughter, and you go out to dinner and a movie and talk about your garden?
I work late. He's staying at my house. It's easier if I stay elsewhere as much as I can.
You can't suppress your life for his convenience.
You don't see a little irony in that? That's exactly what you do for House. I mean, he moved in with you. You bought a bigger place for him. No wonder you're not dating anyone.
You're right. That woman, the woman I'm not involved with, her name is Sam Carr, but in 1990 and 1991, it was Sam Wilson.
Your ex-wife?
No, my mother. Yes, my ex-wife. Ex number one. She friended me a few weeks ago. We started emailing. Turns out she's recently divorced, and I wanted to ask her out.
You can't take a woman to dinner or else House will go running straight back to the loony bin? You're not worried about House, you're worried about yourself because she's an ex. So even dinner will mean it's immediately serious.
Why are you going to Rome? I found the flight information in your locker.
Love how everyone thinks it's so quaint and childlike of me to expect a modicum of privacy around here.
Your flight's tomorrow. What's so urgent in Rome?
I hear they want to tear down the Coliseum to build a karaoke bar.
The Buena Esperanza Medical Center in Rome is doing a Huntington's trial.
Seriously, I live to sing.
I know that they've been doing fetal neural transplantation. I also know that their subjects have increased risk of intracranial hemorrhage. This isn't the time to join their trial. This research is in its infancy. So is your condition.
You read my note, you go through my locker, and then you decide you want to round it off by lecturing me on my life choices?
I'm worried about you.
Oh, well, that makes it all right then.
You read the list of side effects on those drugs? We could crash his BP.
I haven't heard a thump, so I assume he's still quietly puking.
It could be making him worse.
Bigger picture. We're making the hospital better. We can test for whatever you want to test him for once he's stable enough to get back to the hospital. Now stop being a girl and move. So you can ask me about this Huntington's trial, and by ask, I mean give me your opinion.
No. There's one thing, though. Will you have sex with me?
What?
Well, this trial means you're leaving right away. I was playing a long game. Deadlines have been moved up. EKG, echo, and head CT are all spotless. There's nothing on a neurological exam.
Interesting. In favor, indignant, indifferent. I got like a female perspective. Or 13s. Where is she?
She's gone.
She said she was taking a leave of absence. Wanted us to think it was for a Huntington study in Rome. They've never heard of her.
Cell and home phone are disconnected. Apartment's already been vacated. And what's with the death's head cane?
They didn't have a death's ass cane in my size. I guess we'll just have to wait. Conditions that cause intermittent heart arrhythmias. Tal.
3 years you've been trying to game out 13. Now you don't care?
Sorry, not caring about 13 is not part of the differential for heart arrhythmia. But you do get a home version of the game.
Patient's brother has severe congenital muscular dystrophy. Life expectancy of about 25 if she's had a latent case of it.
Wouldn't be sudden onset. Foreman.
Do you know something about 13 that we don't?
She's entitled to her privacy, just as I'm entitled to a diagnosis.
And you're glossing over 13's departure because you actually respect somebody's privacy.
I agree. It's weird of me not to care. So either I'm a changed man because of Cuddy, or I'm pretending to be a changed man because I do know something about 13 and I'm trying to throw you off the scent, or I've just got nutty bananas because I lost a patient. All of which you are free to discuss after I get a diagnosis.
If it's long QT syndrome, any startling stimulus in that skate park could have triggered the arrhythmia. Loud noise, flashing lights.
Scare the patient to death to confirm long QT. Fine. If you insist, do it in a room with one of those thingamabobs that brings people back to life. The wind's coming from the southeast. We have to aim 5 degrees to the left.
We're gonna break 14 seconds. I can feel it. When I was 10 or 11, my dad used to take us to this county fair. And there was this kid. What?
Who's us?
My mom and me.
Your mom, who had advanced stage Huntington's. You have a sibling that you've never mentioned. Why did you slip up now?
Not everything means something. We're gonna be up soon. I want to check the pressure.
You don't wake up in the middle of the night to cry over a dead stranger. You don't confess to killing a man and then hide the details unless the details reveal more about you than the crime itself. Pled down to drugs. You've got a horrible genetic disease and a sibling who's suddenly on your mind. You euthanized your brother. And that guy back at the house was the doctor who wouldn't help you cover it up.
The guy back at the house is my cellmate's boyfriend. He cheated on her when she was inside.
But I was right about everything else.
Congratulations. He couldn't do it himself. The disease had progressed too far. He was flailing. He didn't have any control over his own body. He'd pretty much lost control of his mind, too, but every once in a while, he would have a few seconds of lucidity. He turned to me and he said, "It's time." I hooked up the IV. I used gloves. I knew they'd get me on the drugs, but they couldn't prove who pushed the plunger. I put in the needle, and he just got quiet. And it was over. And I was alone. And one day, I will be that sick, and there will be no one there when it's time. I didn't expect compassion from you. I would have taken commiseration. Hell, I would have taken revulsion.
any emotional engagement at all. It's no wonder Cuddy broke up with you.
Home sweet home. You owe me $87 for gas. I'll kill you. When the time comes, if you want me to. But do it now if you like. Yeah, I've got a baseball bat in the back.
I'll see you Monday.